Hello there. I'm one of the nursing assistants here in the ED. I was wondering if you could come review a patient, Wilfred. He's 78 years old and he's just arrived by ambulance. I don't have any history on him, but he seems really confused. He was found wandering on the street. He's here on his own, but I think he has a daughter at home. He keeps asking for her.
Who are you? You're not Janice. What am I doing here? I really must get back to work.
Wilfred, you're in the hospital at the moment. You were brought in by ambulance to the emergency department. We're going to take good care of you.
The hospital? Oh, that's the most ridiculous thing I ever heard. Where's Janice?
I'll be looking after you today and need to ask a few questions before we can get started.
Oh, sure. That's fine.
Before I ask you anything more, can you confirm your name, age, and date of birth?
I've always been called Mr. Price at work. You can call me, Wilfred, if you like. I'm not sure how old I am.
What pronoun should I use to address you? For example, would you like she, her, hers? Or something more gender neutral, such as they, them, or that person's?
Well, that seems like a crazy question to ask me. That's ridiculous.
How are you feeling, Wilfred?
I feel just fine. Is it time to go home yet?
Try to relax a bit while you are with us. We will help you to begin to feel better.
Thanks for that.
Do you have any questions for me?
Questions? What do you want with questions?
Wilfred, you're in the hospital because you're not too well at the moment. We'll find out what's going on and give you some treatment. Don't worry, you're in exactly the right place.
A hospital? No way. I thought I was at work. Where's Janice? She's good with these sorts of things.
If we need to, is it okay if we discuss your care today with others? People like your family practitioner or members of your family?
Oh, sure. That's fine.
You can view the completed release form on the computer.
Do you know why you've been brought into the emergency department today?
Emergency department? Is that where I am? What in the world am I doing here? I've lost my car. I don't need the emergency room.
Wilfred, can you stay in bed for just a bit longer? We just want to check you out and make sure you're okay.
Okay. Oh, well, that's fine then.
Wilfred, can you remember what's been going on the last few days? Have you been feeling unwell?
Well, I don't know. I was somewhere, and now I'm here. Where am I?
Are you having pain anywhere?
Well, no. Why should I have any pain? Did something happen to me?
Usod pula, usod ka sa usod kasi yeah, simple sad kasi mas kilano na sa Pasim dual ka mit malapit ba? Eh, kasi we chicken gin na parada. From that still punyara. From that still punyara. Yeah. I just made it. Huh? That's why I didn't do it. Trying to still little more this nigga. Papi, mbap tout bon jali lakay, oui? Merci. Mbap tout bon jali lakay. Maybe okay, papi. Thank you. Alright. Okay. Thank you. Bye.
Wilfred, do you know if you have any medical problems we should know about?
Oh, yes. Now, what they are, I couldn't say. My daughter, Janice, knows all the details. Oh, I'm tired.
Do you have any current or history of mental health conditions, like anxiety or depression?
I don't know. All I know is I'm somewhere I shouldn't be. I'm late for work and I need my car. I have to go soon.
I am sorry you're feeling this way. It must be quite upsetting. Can you tell me what medications you're taking, please?
Yes. No. Now then. Well, they've just slipped my mind. Trap. Sorry, I don't remember. I'm feeling a bit tired.
His medication list should be on the computer if you need it.
Hey, have you heard anything about my car yet? I need to find it.
And are you taking any non-prescription medications?
What a silly question. Can you stop asking me questions now?
Oh, he had Alzheimer's.
Blood pressure has been taken, but you can recheck the patient's blood pressure at any time using the monitor.
Well, thanks for that. Now, when can I go home? I'm late for work. Can you tell me what's going on here? I'm late for work, I think.
You can record your vitals on the early warning system chart on the computer at any time.
I'd like to perform a few exams of your body systems. I'll need to lower or raise your gown and touch your body in some areas. Is that okay?
No, no time for that.
I'd like to perform a few exams of your body systems. I'll need to lower or raise your gown and touch your body in some areas. Is that okay?
No, no time for that.
Let me update you on where we are clinically at the moment.
Okay, thanks for updating me on the situation and progress. I've measured this patient's height and weight and calculated their BMI. The information's on the computer for you now.
I'm concerned about you being alone given what you've just been through. Until a family member arrives, I've asked my nursing assistant to stay here with you and keep you company.
I don't need a babysitter. Look, I just want to get out of here. Can you call Janice?
Wilfred, can you stay in bed for just a bit longer? We just want to check you out and make sure you're okay.
Hurry up.
Okay, I need to know a bit more about this patient. Next step is to take a history. You may need to utilize the electronic health records, and I would definitely give his daughter a call to try and find out his baseline. Then do any relevant examinations and try to find out something about his mental status. Call me back when you know more.
Can you tell me what's going on here? I'm late for work, I think.
Hello. Thanks for calling me. I'm on my way to the hospital now. Dad does have a history of dementia, and it seems to have been getting worse over the last few weeks. He thinks Mom is still alive and that he's still working. He's been getting more and more confused and agitated lately. He's been pretty restless and has started leaving the house and getting lost recently. He usually thinks he's lost his car. The neighbors try to keep an eye on him, but I think he's going to need to go into care. We are waiting for an assessment from a couple of places at the moment. In terms of his medical problems, he's got some prostate issues and a bit of high blood pressure, and that's about it, I think. He's not allergic to anything as far as I know. I'll be there soon. Thanks for reaching out to me.
No obvious abnormalities. Wilfred is alert and moving all four limbs purposefully. How would you describe your health overall? Is there anything you cannot do for yourself?
Someone took my car. I was looking for it and thought I parked it somewhere in town. I was trying to find it, and then I ended up here.
Is that what you were doing when they found you? Looking for your car?
Oh, must have been. Well, I think someone stole it.
Can you tell me about your living situation?
Oh, sure. I live with my wife and 2 kids. They're all well, now you mention it. Oh, where's Janice? She should be here.
What do you do for a living?
Yes, I work in real estate. I'm a very busy man. I should be getting back to the office shortly. I need to find my car, though.
How would you describe your health overall? Is there anything you cannot do for yourself?
Someone took my car. I was looking for it and thought I parked it somewhere in town. I was trying to find it, and then I ended up here.
Is that what you were doing when they found you? Looking for your car?
Oh, must have been. Well, I think someone stole it.
Have you taken any vacations out of the country?
No, not recently. I'm too busy with work.
Do you smoke?
Oh, I have the odd one on occasion. Don't tell my wife. She thinks I quit.
I'd like to ask you a few questions about your alcohol intake. Have you ever felt guilty about drinking? Felt you needed to cut back or need to drink first thing in the morning?
What has that got to do with anything?
Okay, I have a few more questions to ask you if that's all right.
Oh, hurry up.
Wilfred was unable to complete the screening test. We'll have to try again later.
Do you take any recreational drugs?
Well, that seems like a crazy question to ask me. That's ridiculous.
Have you noticed any problems with your vision or had headaches or dizziness?
What a silly question. Can you stop asking me questions now?
Thanks for your call. I haven't seen Wilfred in a while, but I remember he was having some issues with his memory getting worse. He does have a known diagnosis of dementia. I think his daughter was concerned he may need to go into care. I'm not aware of any new issues. You should be able to see his regular medications on your computer, as it looks like we have shared records. Sorry I can't be of more help.
Okay, so there are lots of reasons this patient could be confused. I think it's best to speak with the medical team on call and get their opinion before we come and review. I'm not convinced we can help here.
Thank you for letting me know about this patient. I'll need an order from the attending provider to consult on this patient, and we can go from there.
This patient doesn't sound like they have a cardiac issue. If you're concerned, please ask the attending provider to order an EKG and a cardiology consult.
Okay, I think you need to call back the provider and get a management plan for this patient. They can advise you further from there.
Great, thanks for that. It's sounding like his symptoms are largely dementia related. I'll come down and see him soon. If you're happy he's safe and stable, you can move on to your next patient.
The urine dip is done, all clear. You can see the results on the computer.